Hey guys, so I just wanted to talk with you about a change that we're instituting in the emergency room. So we are no longer going to be carrying the communal jellies. You probably have noticed that already have happened in the stock room. We do still have our little individual packets of lubricant, but this is what ED leadership would like for us to please use to protect our patients. So this is a probe cover for the ultrasound machine. You probably have seen the physicians use this whenever they're inserting their central lines. It is required for us to use this now on all PIV insertions when using the ultrasound guided IV. And I know that this isn't something that we traditionally do down here in the emergency room, so I just wanted to record a video so that way you can see how to apply them. In the packet itself, it comes with a probe cover, rubber bands, and lubricant. I don't personally love the lubricant in here. It's quite liquidy, so the difference between using the Tegaderm cover and the probe cover is there has to be a little bit of jelly in between the probe and the cover itself. So my recommendation would be to grab one of the individual packets. You're going to go ahead and insert it on your probe. And then you're going to go ahead and open your probe cover. So we don't have to be sterile for this unless the physicians are doing a sterile application for a central line. For our peripheral IV, a clean insertion is totally fine, so your normal gloves will be good to go. There's a little tear here. You're going to tear that open, and then this is going to be its own little field for you. So inside, you're going to note that you have your band with your rubber bands on it. There's instructions. This is the lubricant that I was talking about, and then this is the probe cover itself. And so on the probe cover, you're going to note that there's some stickers on here and some indications. So the circulator pull is going to go away from you, and your hand is going to go inside where the arrow is. So you're going to insert right above the arrow. That's going to create a little pocket, and you're just going to grab onto the probe, keeping that jelly in place. You're going to grab your probe like this, and where the circulator pull is, that's where you're going to pull down, and you're going to create a nice tight barrier where the jelly is still under your probe. At this point, you're going to get one of your rubber bands, and you're just going to apply it to the tip of the probe to make sure it's nice and tight. And so when you're using this on your patient, you're going to apply additional lubricant on top. You can use the sterile one that comes in the kit. Again, it's very, very liquidy. It's not my preference, but if you like it, please do use that. And then it's just going to go on top, and then you're going to be good to go on your patient.